me in the world of family medicine and the world of the American Academy and the world of WONCA. And so I'm just excited that the AFP has asked you to have me in this candid conversation.
We're really excited and, definitely bring greetings from the AFP and North America region. And really, in interviewing you, Dr. Viviana Martinez-Bianchi, we really wanted to look at your platform for Wonka and really your vision. In your platform that you have online, you wrote that your vision is to strengthen family medicine and guide Wonka to being a major worldwide contributor to equity and justice in health. And you have a mission that says that you propose for Wonka to be the most trusted primary healthcare organization in the world. We're really excited that we're going to be hearing more about your ideas about Wonka for that. So, what are your thoughts on how you're going to make those things happen?
Thank you again for this question. So many of my goals are tied to the work I have been doing for the last 30 years. Um, and when I think about how can WONCA contribute to equity and justice in health, I think about collaboration with countries, with policymakers, with the public and the private sectors, with community stakeholders to affect positive change for the populations that we are serving, that we serve. As family doctors, we're embedded in the community. We're the first ones to know what's going on. And WONCA, in many ways, represents every one of us. And so, in this idea of equity and justice in health, I think of creating the strategies that help us as a large organization mitigate health inequities, guiding the development of strong primary health care that is comprehensive, person, family, and community centered. We, as family doctors, work with society. We learn to confront the root causes of health inequities. We think of the planet and planetary health. We learn about the distribution of diseases and illnesses and see, we know already before even data is out there, what's happening in each community. And we are looking to provide everyone a fair and just opportunity to be healthy. And that's what health equity is. So being in this role with WONCA, I hope that we really guide the whole world to really think about a strategy to be putting health in all policies, that we engage policymakers that often don't know what true primary healthcare is like, to put a family doctor team for every family and every community.
That's
And there's more
wonderful.
to this, right? But it's we that we
Yes,
work together as
indeed.
educators, as what some of my colleagues call the front line, the primary care doctors on the front lines, that every one of us works in leading this approach.
And I think about all the different things that you're doing and I'm really excited about the work that you've been doing, but part of your proposals as Wonka president, what do you think will have the biggest impact on each Wonka region?
So if I think of all the worker regions, I think the idea of organizational equity and representation is the one that is most important that comes to mind. We just had a very important meeting with the organizational equity committee and the presidents of each region. I hope to really build this idea of um, being somebody who is responsible, a president elect and president that listens and puts plans in action together with each organization in each region. My first priority will be to meet with every one of the regional presidents and the member organization leaders in each region and figure out together how to make WONCA most important and positively impactful for you. When I think about purpose driven systems, we know that all partners at all levels align around values that are transformative, that change us all, that have that are built on strong relationships and goals that move us all together towards organizational equity, integrating emphasis on preventing harm, supporting actions that heal and transform. And when we talk about harm, we know there are regions that don't feel included, that have a difficulty coming into meetings because it may be too expensive. Or if we have, and now with this higher, when we have video platforms, but when we are together, we can't continue to count on just scholarships to make it feasible to get together. So really working together on geographic, language, um, all of the areas of organization that really make us not feel included. How, who is included and who's not? Um, is it geography? Is it rurality? Is it small island states? Who is it? Who is not here and why? And so bringing everybody together, I think that would be the part that will be most inclusive.
Oh, I love the way you say that, especially about inclusion and making sure, voices are heard from all the regions, which I think is so vital and so much needed. Um, what are your past experiences that you bring to the position of president elect and then as president?
So I think I owe much of who I am and the foundation of the community and globally engaged doctor or family doctor that I am today to first having grown up in Argentina in a developing country. Even the idea of having grown up under a dictatorship allows me to understand countries that are living through times of political difficulty and turmoil. Being an immigrant to the US, navigating the spaces of different cultures, and then having done medical training both in Argentina and the US, and then I did family medicine residency in a community hospital in Illinois at Hinsdale first. Then I went on to family medicine residency and being a chief resident at the University of Iowa, to then working as a rural family doctor where I did full spectrum family medicine in Muscatine, Iowa, then being faculty in a community-based program and now in an academic medical center, to then 3 fellowships on equity and addressing leadership in how to look at health systems change. That was my 4th fellowship, the one on health systems change and leadership. So I bring many years of work, education, and living in these different spaces, and also the work with American Academy of Family Physicians. You and I worked together with Family Medicine for America's Health. That was such an exciting time of working, bringing several teams, very important organizations within the US. And then, of course, my role with WONCA at the World Health Organization. So all of them make me who I am and how I try to be representative. I'm a talker, I'm also a listener. I will pay attention and I will be an advocate. So those are just some of the things that I bring to my role.
And I know that you've really spent a lot of time being so inclusive. Like I've seen your work both in the AFP and Family Medicines for Breast Health, at WONCA, in the communities that you serve in North Carolina, where you bring other organizations in and say, who's not here around the table, who needs to be here. And I think that's one thing that I truly treasure about you, Vivi, if I may say, just Vivi, dear friend, that you have that ability to bring everyone that should be at the table to the table to make those important decisions. That's something that I see as a real strength. You talked a little bit about your work with the World Health Organization. Could you share? I mean, you've been doing that for 5 years now, representing WONCA on an international stage. What lessons have you really learned from your work as WONCA's liaison to WHO, and what are the priorities that you see WONCA should take in the coming years?
Yeah, very, very good question. I have learned many things. I have learned lessons that regard policy, politics, knowledge. I have learned to listen and craft a message um, to the listener, to understand that there are certain priorities. Each country, each organization has certain priorities, and as long as we are clear of our own priorities as a WONCA organization, that we are able to convey that message. That there may be differences between countries and countries, But we all have an interest on making sure that people do well, that our people do well. I also have learned that we have many allies supporting primary health care and universal health coverage. We have allies at the World Health Organization. We have allies at UNICEF. We have allies in many, many countries. And at the same time, we have a responsibility as civil society, as physician organizations, as family doctors, as communities to figure out from our own governments what is the true commitment of members of the United Nations, for example, to when they're signing on a declaration for universal health coverage, what are they thinking about? Do they know the complexity of the work that we do as family doctors? Do they understand that we need to support the training of enough number of family doctors to really be congruent with community needs, right? Do that they understand that we need to support the training of rural family doctors and their teams. You know, doctors alone will not do it. We need doctors, nurses, we need community health workers, technicians. We need the whole team working together. And so we have to really work with that country support. That if we are hearing that our countries are signing on to certain declarations, then we need to be ready to go in and talk with whoever is in charge. You know, is it the Ministry of Health? Is it president? Is it legislative assemblies? To really go through, okay, these are the promises. Where is the funding? How do we support the training of primary healthcare teams? So I learned a lot about talking to WHO state members, supporting the training of family doctors, you know, talking with, and also with the World Health Organization, how large is the primary health care area? And do we need a larger group of people that are really advancing this primary health care and universal health coverage agenda?
I love what you said too about training, right? I mean, you've spent many years of your career in training the future family doctors in family medicine residency and guiding, thinking about how Wonka guides governments. You said that you aim for a Wonka that guides governments on the how, where, and when should we train family doctors and their teams. What is your roadmap for that? And you've talked a little bit about that in terms of making sure that you're at the table talking to these governments. But how can we do this? What is your roadmap?
So we need to do this in a statewide approach. We need to start with getting together with each region and every member organization, but start with the regions, learning where each region is, where each country is in the development for family medicine in their region and country. How many people do we know? We need to do a survey of assets and needs in each country and region. What is the number of people? What is the number of family doctors? What is it? What is the need, right? We need to establish the number of family doctors that need to be trained in each region. What are the current existing possibilities for that training? What is the capacity of local medical schools and postgraduate training programs to meet the needs of that region? Who is already on the ground? Who is already doing primary health care? Who is ready and able to do the training that is needed? And then how can we collaborate from country to country and region to region? So we need to start doing these assets. What do we have? What do we need? And then set up parameters. For example, in the US, we have been saying that we may need to increment the number of training sites or the number of students going into family medicine by 25%, but in another country, maybe 500%, right? That we actually need to start thinking, how do we meet needs at the community level? In other words, we need to get together, map it out, and see where we are, where we went, where do we want to go to, and not only think of the support of family medicine training, but the healthcare teams, right? We just can't do the doctors only. We need to do the whole team. In fact, in my department of family medicine and community health, the first dreamer of our department back in the 70s was that he was going to train teams of a family doctor, a physician assistant, a nurse, and a team together to go to work in rural North Carolina at that time. So we just need to think outside of the regular boxes and make it happen.
Yeah, absolutely. And it's really exciting to think about how these physician led primary care teams are changing the world around, the globe. So it's exciting to hear the different sort of stepwise progression that you can see Wonka really playing a huge part in the development of pipeline and workforce programs throughout the world and in different nations.
If
Thinking
I
about,
may, sorry,
yes,
moment. If I may add something about the concept of pipelines, we always think about a pipeline, and I think we need to start. And the problem is who gets into that pipe. It's
yes,
always very difficult. It's complex. It doesn't happen. So we need to think about the concept of rivers and smaller tributaries that make into a big river. Just thinking about who is coming in and who is not being included, right? There's a certain group of people that are the ones that make it into that pipeline that may not be the ones that are interested in family medicine for whatever reason. So we need to go to a bigger approach, instead of a pipe, kind of a river tributaries, and going to rural places to look for students that are growing in rural parts of the world that may want to train in family medicine and stay back in their hometowns to practice. Right? So creating a different concept of how we are including training.
yeah, it's exciting to think of the whole different systems that need to come in place to ensure that we have a robust primary care health system that really meets the needs of each and every community with individuals from those communities that look like the individuals and patients in those communities. So I totally agree with you. Totally agree with you. Now we know that in the past year and a half with COVID, it's really taken a toll on on primary care and on family doctors around the globe. We've had many who've fallen sick, some we've actually lost, and so I've thought about how many family doctors are truly burned out from COVID and the work that they've been doing. And I've thought, what is it that Wonka can do to support these doctors?
So there's several issues. First of all, my heart goes out to all of us because we have lost many, and that we now know that among all of the medical specialties or practices, general practitioners and family physicians have been the ones that lost more lives, right? That among physicians or doctors, our teams were the most affected worldwide. The largest loss is among family doctors. And I think it was a failure of recognizing the importance of family doctors in primary health care, that the initial, and even today, the pandemic response concentrated everything inside the hospital when this is an illness with community spread, and underestimated the level of exposure the family doctor teams had on the ground. So let's first of all recognize that, and that we needed and we still need equitable distribution of PPE, right? That personal protective equipment doesn't just belong inside the intensive care unit. Of course, it's very important there, but it belongs in the community. We also need to recognize that vaccines need to be equitably distributed, that we cannot accept the inequities that we see all around the world, that we are aiming for 70% in some parts of the world and not even at 20% is a travesty. And so, how do we really get the vaccines that we know save lives and diminish death and poor outcomes? How do we get them everywhere? How do we all together advocate for a world that has equitable access to them? And then, for every family doctor on the ground, is the idea that we have to listen, we have to represent, and to represent, we have to listen, and we have to do a call for action, that we have to really get together as global organizations and go from the calls to the true work that says we are supportive of your work, we are supportive with fair pay, we are supportive with equitable access to vaccines in personal protective equipment. We have to stop this idea that doctors have to take more than one job all over the world, right? Like we have to, because they can't make ends meet. We have to really, really get together and think about what are the policy perspectives in which we all need to work together to really support the very hard and comprehensive work that we are all doing. Um, so those are some of my thoughts. I
Yeah.
If I had the funds, I would go on and get PPE to everybody, but we need to get together to really say enough is enough.
And surely, yes, definitely the PPE, the vaccines, the support, the financial reimbursement, but mainly the support. I think I totally agree with you that I think that's the beauty and wonder of Wonka, is that because it is a world organization of family doctors, that we can meet together, that we can join hands together, that we are stronger together, to really be able to bring the needs of both our patients and our community of family doctors, their needs forward, and to be their voice. So I just want to ask a final question, if I may, Vivi. Um, what is thing, your one thing that you really hope to bring to Wonka?
One thing, love. I Much of the work I do is derived in love for my community, and my community is you, is my colleagues all around the world, is um, my community, my Latina community, my international medical graduate community, my community of family doctors, my all of these things, right? And all of that is, I think, it's driven by a love for who we are and what we do. Um, and with that comes the rest, right? You cannot do this kind of work without loving the people that you're working with. You cannot do this kind of work because it's long and it's tiring and if you have to love this, and you have to love with your ears and your eyes and your heart, with your ears to listen to all voices, with your eyes to be curious and see who is there and who isn't, and who needs to be there, and to understand the nuances of meetings, so that when we are in disagreement, we can step back for a moment and say, you know what, we might have differences, but we love what we do as family doctors, and let's see how we can reach some degree of agreement when we're working, especially with many different people representing different parts of the world that see culture in different ways, that see the way we run businesses in different ways. So I think love is a part of that, right? If you look through the eyes of love, you're able to accept differences and then move forward, um, to grow and do better.
That's beautiful, truly beautiful. And I think fitting to close on the thoughts of love, we want to share with each one of you that is out there right now, all our Wonka dear family doctors. Thank you so much for everything that you're doing around the world. And we hope to see you at the Wonka Council meetings. And I'm going to personally wish Dr. Viviana Martinez-Bianchi the best, all the best in this run for candidate for president-elect for Wonka. And just thank you for your thoughts. Thank you for your love that you share with us. And, I always think of the words Ohana. Ohana is family, and family means nobody gets left behind or forgotten. Thank you for always in everything that you've done, making sure that no one gets left behind or forgotten. Thank you. Thank you so much, everyone.
Thank you, Kim. Thank you, AFP, for all of the years of learning through activities with the Academy that allow me to be a positive leader with Wonka. And I hope to be able to continue to make a difference.